what is a myocardial infarction, how does it all happen. And I kind of wanted to start with a personal experience with a friend of mine who had a myocardial infarction and was rushed to hospital. So this was a friend that I knew who had just turned 80. For the entire prior year, she had slowed down a lot. She was a person with incredible energy who all of a sudden, I'd known her for about 20 years before that, from the ages of, I think, 60 to 80, and she just had life in her, and all of a sudden she didn't have life. And it terrified me to see her because she could barely stand, she had no energy, and the year after, she had a congestive myocardial infarction. And I went with her to hospital. She was admitted to intensive care, and they give you a lot of things. And I wanted to walk through some of the medications. This person was a vegan for about 40 years before. For about 20 years prior, she had had severe acid reflux. And for the acid reflux, she was given proton pump inhibitors. Anyone familiar with those? Prilosec? People familiar with acid blockers, Prilosec? And what they do is they are not meant to be eaten for the long term, temporary, 5 to 6 weeks. What they do is cause major adverse coronary reactions. And it affects the nitric oxide in your small capillaries, which need to dilate in order to get blood, oxygen, etc. into your organs. So one of the things that I was very worried about with her was that she was eating a lot of proton pump inhibitors. She was in a very vegan diet. She was getting very few proteins. She was on a low-fat, low-salt diet, so she had no minerals, no proteins, no amino acids, no fats. She was admitted to hospital with shortness of breath. The Kaiser ambulance picked her up. I think the total bill was $250,000. One of the first things you want to administer to a heart patient is magnesium. And I asked, there was no magnesium in any of these medications. So she was given Lasix, which is a diuretic, which is used to get fluid out of the lungs, and it's for high blood pressure and swelling. But the side effects are terrible. So she had chest and jaw pains, ankle swelling, muscle cramping. She was very dizzy when she stood up. Your stomach goes to smithereens. You can't digest foods. Kidney function gets damaged, so your kidneys get very, very damaged, and it eventually destroys the kidneys. If you take Lasix for a short time, that's in an emergency, that is okay, but she is still on Lasix a year and a half later. She was given something called Zosyn, which is a very powerful antibiotic given to ward off infections. Guess what hospitals are the harbinger of? Things like MRSA. The golden age of antibiotics is over, and they rightfully give out powerful antibiotics that destroy your gut. When your gut bacteria is destroyed, you can't make any of the metabolites in your blood. And so she was on antibiotics for a very long time, and the chances of getting C. difficile hospital infections actually increases if you're on these high steroidal, high-powered antibiotics. She then, effects of Zosyn are nausea and bleeding. So she had a lot of nausea and bleeding. Her whole body was like a map of red blotches. Aspirin, it was given with aspirin, which causes more blood thinning, more injuries to the small vessels, and clopidogrel and heparin, which are also blood thinning agents. So within about 24 hours, she was on these 10, 15 different drugs. The hospital serves not organic food, white bread, canned peaches, margarine, and some just terrible stuff. I brought her these pastured broths with soft meat pieces and gelatinous and so on, and somehow she got the notion that fats and salts are what did her in. Mind you, for the 40 years before, she had not eaten fats or salts or meats, and was on proton pump inhibitors. So she rejected the broths, the fats, went on a very, very low salt, low fat diet, and the quality of her life to this day is just terrible. I mean, she teeters between death and not death. She can't walk, she can't digest, she's in her bed 24/7 almost, and it's a matter of time. It's a matter of time before something happens. They gave her something called fentanyl. Side effects are fever, rashes, itching, constipation, and brain fog, and she had all of these. Heparin causes severe bleeding and thrombosis, so she had, just bleeding all over her body. Plavix or clopidogrel, and they put 2 stents in her body. One of the things that happens when you're 30, 40, or 50 and you have some shortness of breath and you walk into a doctor's office, the doctor is going to say, hey, I'm going to put you on a stress test. So they put you on a treadmill, you time out, and they do this a test of your arteries, and they say, holy Moses, you are 70% blocked, or you're 95% blocked. And many people are told that if the blockage increases anymore, you are in danger of getting a heart attack and dying. But step back for a moment and think about this. If you're sitting up, right? If your arteries were blocked 97% and were open, if you had only 3% function, would you be sitting up, much less walking to a doctor? No, you would not be. When your arteries block, the 4 coronary arteries that feed your heart block, there's something called collateral arteries that open up, and those are the ones that are making sure you're alive. And when you put stents through the primary arteries, the collateral arteries actually collapse and make things worse. All the epidemiological studies that they have studied say that putting stents does not increase the survival rate of heart patients. They do not survive longer. So what happened with my friend was she went in with shortness of breath, which is why I got terrified when you had shortness of breath.
I didn't have shortness of breath.
You didn't have shortness.
Just the heart pumping.
Heart pumping. You go to a hospital, they're going to tell you your arteries are 70, 80, 90% blocked. You're going to come out of there with stents in your heart. If you have stents in your heart, you're going to be put on aspirin or any of heparin or the blood thinners, which destroy your kidneys, destroy your digestion, work as a net antibiotic, and it doesn't save your life. It doesn't increase your lifespan. And so what typically happens in heart disease is a 40, 50-year-old person will walk in, get a few stents or bypasses even, and they're sent back home, but they have heart attacks still. They may have high cholesterol, they're put on low cholesterol lowering drugs, but that doesn't prevent heart attacks. And so what we're going to look at is a slightly different concept of what heart disease is, and that is a different theory than the plaque theory, the cholesterol theory, the lipid hypothesis, which says that fats cause cholesterol buildup in your blood, and that causes heart attack. Nothing, in my view, could be further from the truth, because all the people that I work with and I talk with, they have solid levels of cholesterol in their bloodstream. People with high cholesterol over the ages of 60, 65, women in particularly tend to live longer, not less. So anyhow, she was given fentanyl, which is a painkiller, heparin, which is a blood thinner. She was given Plavix, which causes severe bleeding, bruising, severe osteoporosis. So now she has severe osteoporosis, and if she falls, she's going to break a hip, and that's going to be the death knell. Zofran is an anti-nausea pill which causes stomach cramps and pins and needles because it takes your ability away to have digestive acids and so forth. Morphine is a sedative, and she was on that a lot. And so when she came back from the hospital, she was like a walking zombie. She was like a walking zombie. Then she was constipated, so they gave her Colace, but Colace is detoxified in the liver. Then it's absorbed into the bloodstream, excreted through the gallbladder, and then it's a big net load on the liver. And the side effects of stool softeners are pain, diarrhea, cramping, throat irritation, rectal bleeding, rash, hives, Long term, it will cause your colon to lose its natural ability to contract because it's a stool softener, and make your constipation worse over time. So a lot of these sort of fake medicated stool softeners actually are very detrimental. You want to avoid these in pregnancy and nursing, by the way. And opioid use like morphine and opium, etc., will have a similar effect. So if you don't have constipation, you don't have to worry about this. But in a life and death situation in a hospital, you're administered all these drugs. She's got to be on aspirin for life. She's got to be on aspirin for life. Aspirin is a non-steroidal anti-inflammatory, and what it does is it destroys your body's ability to make something called proteoglycans, which is connective tissue. So people who are on aspirins are more likely to have connective tissue disease, plantar fasciitis, sprains, tendinitis, joint problems, and so on. It destroys your gut biota. And so whatever destroys your gut microbes has a very deleterious effect on just about everything because you can't digest food as well. It causes insulin resistance, hyperglycemia. So aspirin actually raises your blood sugar levels and it depletes your muscle glycogen. So you have these moments of too much blood sugar. And so I would say avoid aspirin. It inhibits lipolysis, which is fat breakdown. So when you are eating aspirins, you have troubles digesting your fatty acids. So you want to remember, every senior I know that I've talked with, the doctor tells them, eat an aspirin a day, it'll save your life. Think hard about the side effects, the consequences of aspirin, and if you don't need it, if you don't have stents in your body, if you didn't have a heart attack, I would say avoid aspirins.
My father was supposed to take one of those baby aspirin, you know, but he went to the store when he ran out and got the regular kind without realizing it, and was taking one a day, and he all of a sudden just went collapsed. Yeah, and they did about 1,000 tests on him, and I kept saying, you know, he just got the aspirin wrong. He was taking a whole one instead of a baby one, and they still did all the tests, and they said that he just was taking the wrong aspirin.
Yes. Kidney disease, it'll destroy your kidneys eventually. So it's used as a blood thinner post-surgery so that your blood doesn't clot, and you will likely be asked to take it for a while, especially after surgery, after heart surgery, stents, and bypasses. It depletes your folic acid. Aspirin, all NSAIDs deplete your folic acid, your minerals, iron, potassium, sodium, vitamin C. Vitamin E taken with aspirin will cause excessive bleeding, colitis. It damages the brush border, the villi of your intestines, and it kills the enzymes which are on the brush border. So what's it's really doing is it's causing malabsorption. So it's not a benign drug at all. So when you have malabsorption of things like iron and calcium, you have problems. And then you start getting indigestion, you get acid reflux, and what does the doctor prescribe to you? Prilosec, lansoprazole, etc., various acid blockers. And what the acid blockers are doing is taking away, sucking up the ability of your body to make hydrochloric acid. And what do you need hydrochloric acid for? Anyone?
Digestion.
Digestion of which particular thing? Stomach? Proteins.
Oh,
proteins. And proteins are the building blocks of your body. All your enzymes are made of proteins. All your muscles are made of proteins. You just need proteins. And so what is happening is you have a bunch of drugs that are serving to cause the very disease that you're being treated for. So aspirin is not a benign drug. On the other side, I asked the doctors, did you put any magnesium in her drip? Are you giving her magnesium? It is one of the most important minerals you can give for a heart patient. It shines brightest in cardiovascular health. It fulfills the role of many of the common cardiac medications. So a lot of the medications are given for certain reasons But magnesium is a mineral that has no side effects and will help with a lot of those. Like it inhibits blood clots. You don't want to eat aspirin, but you want to eat magnesium. It thins your blood like Coumadin without the side effects. Okay, it blocks the calcium uptake like the calcium channel drugs, but it does not have the kind of side effects, the terrible side effects that these drugs have. It relaxes your blood vessels, so your capillaries are able to send oxygen and food out into your tissues. So magnesium is something, if you ever have a heart attack, keep magnesium handy, or if you suspect a heart attack, if you're short of breath, try magnesium. It will have a very positive effect on your body. That's the one supplement I would recommend for people.
Is it something good to take all the time, or
not all the time. If you feel you get cramps, if you feel shortness of breath, if you feel you have digestive difficulties, if you have constipation, magnesium is awesome.
But not necessarily.
Not necessarily, yes.
What
There's,
form do you recommend?
magnesium, there's a thing called calm. Is that like a fat-based magnesium? Renee, talk about
it's a calm powder you stick in water. You can take it every morning, or you can take it 3 times a day, or you can put it in your water that you use during the day. I take it in the morning.
You can dip your feet in Epsom salts. You can rub magnesium-based oil sprays on your body, and it will get absorbed.
So this is a question about Calm. I was gone for a year and I left a giant thing of Calm in the cupboard. So now it's expired. Does that matter for that type of a product, do you think?
I would think it's a mineral. Just
Yeah,
grind it
yeah,
up, put it in your water.
Expiration dates and they.
Is that CALM?
CALM. But all sorts of magnesium compounds
And
will
the
work.
calm comes in, it's lemon flavored or some other flavored and
Yeah.
natural.
Yeah.
And I was told you don't want the flavoring, which I was always using because I liked it.
Yeah.
But just put your lemon, do your calm and just take a fresh lemon and squeeze fresh lemon into it. It's
I
natural.
take it at night because I have terrible cramps.
I see. Potassium and magnesium in food form, so drink lots of raw milk. It would be very good for you. Stop cramping. And magnesium-rich foods are oysters.
Excuse me, when you interrupt, you talk about cramping where?
In her legs.
Like my feet
In your
just
legs.
go into like
Yeah,
a,
that's what
yeah,
happens.
it's crazy.
Charlie horses. Oysters are a great source of minerals and very digestible. And the thing about minerals is people take all these pills in powder form. They go in your mouth, out the other end. And many of those, porta potties, they literally find these undigested pills, Minerals need fat-soluble vitamins to be assimilated and carried into your body. So eat magnesium, calcium with fats, with butter, with, cream, in bone broth. Fats are very, very easily assimilable. So you'll find that if you eat minerals in these forms, even a small amount of mineral, if it's 100% digested, it's way better than a powder that is indigestible, where you only digest 5 or 10%. But magnesium and heart disease, magnesium and any kind of muscle health, very important. You don't have to eat pills, magnesium pills, but eat greens. Anyone who's on a keto diet, 3 fistfuls of greens every single day.
Eat what?
3 fistfuls of greens.
Greens.
By greens, I mean not lettuce, but green greens. It could be broccoli, Brussels sprouts, leafy greens, kale, spinach, the deep greens. They are loaded with magnesium, but eat them with fat. So saute them with onions, garlic, and fat of your choice. They're delicious as well.
Would you consider celery and cucumber greens?
Great sources of potassium, yes.
Potassium.
But yes, in addition to those,
Potassium?
yeah, potassium.
Because I did increase my magnesium, except I had a standard process form, a
I
pill.
think it's magnesium citrate or something. They're great, standard
Yeah.
process is great. But up your mineral-rich foods dramatically if you have heart problems, cramp problems, and remember, you can get a cramp in your heart, same as you get Charlie horses and you got only one heart, and your legs can rest but your heart cannot. So magnesium it relaxes your blood vessels like ACE inhibitors without the side effects. So I found it, in fact I argued with the doctor and I found it astounding that they were giving her ACE inhibitors, channel blockers, Coumadin, aspirins, but not giving her magnesium. And so please take the trouble to put magnesium in a bottle of water if you have shortness of breath, if you feel things in your belly, and just eat it. It will not kill you. It has very few side effects.
Can you take too much magnesium?
No, you'll generally excrete it. But you can take too much of the drugs and you will die, yes. Magnesium is depleted by a bunch of things. It's depleted by estrogen compounds, like oral contraceptives. It's depleted by antibiotics, cortisone, prednisone. So if you're on any kind of steroids, your magnesium will be depleted. Her magnesium was seriously depleted because she was on proton pump inhibitors for 22 years. And so what PPIs do is they take away your ability to absorb minerals. And that interferes with capillary dilation. And one of the major causes of heart disease today is a lot of people are on proton pump inhibitors. And it's little known. There's a guy by the name of Dr. John Cook who's done a lot of research on major coronary events from acid-blocking drugs. And we are giving acid-blocking drugs to seniors who actually have low stomach acid. So what they need is more stomach acid, not acid blocking, to enhance their heart strength. Food processing lowers the levels in the soil. So the soil, if you're not eating organic foods, you're going to have less magnesium. In the farming techniques, there's less magnesium in the foods that we're eating. Sugar. Every molecule of sugar that you eat requires 56 molecules of magnesium to metabolize it. So if you're eating sugar, please eat maple syrup, please eat honey, please eat jaggery, where the magnesium comes combined with the sugar. When you eat sugar, eat it with minerals. So avoid refined sugar, eat sugar that comes in a package.
I don't know if anybody, how much you eat of like the drinks and stuff that you can find, but I have heard that 1 cube of sugar equals 4 grams of sugar in the nutrition thing. So if it has 12 grams of sugar in there, that means you're eating 3 sugar cubes.
Yep.
So
It's quite revealing when you look at that, because a lot of things have like 25, 26, 28
2 or 3
sugars
teaspoons of sugar.
in those nice protein drinks.
You had a Priscilla? You had a
well, I'm using I know honey is sugar, so I probably use it, but I find a little tiny bit is very
invigorating.
sweet.
Oh yeah.
And then coconut sugar when I'm cooking.
It's
I've
awesome.
been using
Yeah.
that. So.
It is loaded with minerals. Coconut sugar is loaded with minerals, jaggery, honey, and so honey has proteins in it. It has enzymes in it and huge numbers of minerals for the bees. And so, but try and eat raw honey, and you'll
And
do
so what
very
is
well.
it about Manuka that's so special?
Manuka honey is from certain flowers. So this is honey of it has pollen of a certain kind, proteins of a certain nature, very rich in enzymes, very rich in minerals, particularly rich in minerals.
Where does Manuka honey come from?
Many countries, New Zealand grows it, India grows it, parts of Europe you can get Manuka honey.
I thought honey you should get from local areas because
That's what
Yes,
I'm thinking.
yes.
Apparently that might be a myth, but it's nice to just buy local.
I don't know.
They say because of the flowers.
So it depends. If you have asthma, if you have allergies,
Yeah,
then
that's
local
the
honey is a
reason
good
for
thing.
local honey.
Brit?
I used to raise bees
You did.
until I got my Parkinson's.
Mhm.
So I have some very old jars of honey in my shed.
Mhm.
It's getting very dull.
Mhm.
And I wondered why would that be?
Darkening of honey. It will age, but it will not be destroyed. Honey will last for 2,000 years. So
That's what I
please,
thought.
aging will might probably make it a whole lot better. It's very edible, and it's probably very rich in just about everything. So savor that sacred honey. If it's very old honey is supposed to be very, very good for you.
And made with love.
Go and made with love, yes. So, but local honey is a good thing if you have allergies, inflammation, and so on. It has pollens, local pollens, and people who eat honey frequently get cured of asthma, and I experienced that. Raw milk and local honey cured my asthma.
The milk helped you?
Milk, raw milk.
Is phlegm producing.
Yes, yes. So there's a big difference between raw milk and pasteurized milk. Pasteurized milk is, in my opinion, poisonous swill, and I would rather not drink pasteurized milk at all if I had the only choice, and that was pasteurized milk. I came here from India and I stopped drinking milk for about 30 years because it would give me instant diarrhea, it would give me mucus. Raw milk is milk that comes straight from the cow. It's not processed through pipes, and by God, it's like life. It's life-giving. I had very severe asthma, and medications didn't help, and raw milk cured it in 60 days. It absolutely cured. Children with asthma, you give them raw milk, eczema clears up, asthma clears up. It's a magical food. It's just blood without the red blood cells.
Why
Basically.
do you think, we're talking about pasteurized milk, which is all you can buy in the
Yes,
stores.
yes.
What is the difference between that and the raw milk?
Ah, very
That
good question.
creates the problem.
Yes, yes. So what they do in pasteurized milk is you're taking milk from millions of cows, passing it through 5 miles of pipe at very, very high temperatures. You know how the goop that gets created in a pot when you heat milk? Imagine that goop in pipes, and that cannot be cleaned mechanically. That is cleaned with carcinogenic chemicals like hexane.
Yeah.
So right off the bat, that milk contains a lot of
Well,
chemicals.
they're chemically changing the milk.
They're chemically changing the
Yeah,
milk.
okay.
The proteins are getting denatured and destroyed. The proteins are stereoscopic compounds, and if you take it and flatten it by passing milk through 180-degree steel plates, you're destroying the proteins in the milk. You destroy the enzymes in the milk. You destroy the immunoglobulins in the milk. You destroy the fats. You make them rancid. You destroy the good bacteria in the milk. And so really you're turning that milk into Kool-Aid. That milk is not just bad, it's toxic to your health. It's nothing but sugar water. Whereas raw milk contains all the components. It contains an entire immune system. And just a cup or a half a cup of raw milk will cure so many diseases. I know people whose colitis disappeared, skin conditions disappeared, children especially, vaccine-damaged children do very well with, once they get used to the dairy, do very well with raw milk. And people who are lactose intolerant or who get diarrhea from drinking milk, 85% of the lactose intolerance is not seen in raw milk. So I couldn't drink pasteurized milk, but I can drink raw milk. The other thing that happens to raw milk, pasteurized milk, in addition to pasteurization, is homogenization. Anyone say what homogenization is? It's passed through a Vitamix. So remember how the farmer, when you were young, delivered these bottles on your door with cream floating on top? Well, people would buy from the farmer who had the most cream, because cream was valuable. So they decided to make that go away. So it was a marketing technique that basically made all the cream completely homogenized in the milk and made it very, very toxic to human consumption. Because now the proteins are broken into parts, so the body raises an immune response to these smashed proteins in your gut. And so most people, pasteurized, homogenized milk consumption has gone down 1% every year, while raw milk consumption has gone up 15-20% year after year, which is why all our raw milk farmers are being attacked. They have to operate in secrecy. The big dairy is trying to shut these down because while farmers are committing suicide and shutting down dairies for the pasteurized milk industry, the raw dairy farmers are able to charge $15-20 bucks a gallon for milk because it's such an amazing fluid.
And I get groceries from my neighbor because she's homebound, and I was telling her, she was getting Strauss milk delivered to her door, and the Strauss dairy pasteurizes, but they don't homogenize, and they're organic pastured cows. So she had to stop getting the deliveries. So I went out to get her milk, and I was at Trader Joe's, and they don't have this Strauss milk there. So I went, I'll get the organic clover. And so I took it home to her, because I figure organic milk, they're not going to homogenize it. Well, in little letters where you don't see it on the main part of the package, it said on there homogenized. And she said, why did you get me Strauss Dairy is the only organic one here that is not homogenized.
It's not.
All the others, organic ones in the market, now maybe not all the others, but the ones that, most of them,
The ones that are.
you have to look,
Yeah.
they're
Is
homogenized.
Strauss selling in the different supermarkets in Marin?
Yes,
Yeah,
it is.
they sell all
They
over.
sell it.
In glass bottles.
Woodland store has
Glass bottle is usually a
Yeah.
good sign.
Sprouts has it.
Woodland store.
Sprouts.
There's a website called cornucopia.com. You
Mhm.
guys all know about that?
No, no.
It rates all the dairies.
Oh,
It
that's
rates all the
awesome.
dairies, and there's a 5 cow and a 4 cow and a 3 cow. It's very, but Strauss is only on the 4 cow. There are about 3 dairies that are on
About
the
that.
5 cow.
I see.
And then there's a fair number in the 3, and then some.
Mhm.
And I was hearing on NPR how I heard about this is, they said that they have to have somebody check them, a regulator,
Yes,
for their
pasturing habits.
pasteurizing and all that. But the government doesn't actually provide those regulators because that would be too much money. So the company is required to hire their own regulators.
Oh, mhm.
And so Cornucopia is the place to go. And
Yes,
it
yeah.
is very interesting because there are some that you realize, you see those that you're used to thinking are good are in the 1 cow department.
Oh. And
Yeah, it's a
that
really
you
good
made
love
It's a
a
really
very
good web,
important
it's
point.
good,
Yes.
but it's a really good website.
So cornucopia, everybody go to cornucopia.com
I believe
and
it
check
is,
to see
yeah.
the number of cows they have.
Yeah.
Stars, that's the 5, go for the 5 stars. And that is another point you bring up is people eliminate entire groups of foods because they're so bad. People eliminate dairy, people eliminate wheat, they will eliminate, certain produce. But there's an alternative. You can go find a farmer and you can go look at their cows and see that they're out on pasture and only buy from that farmer. So you have a choice. It takes a little bit of work. But I would recommend against pasteurized, homogenized dairy, especially if you have heart disease. Because what happens to the calcium in the milk when the milk is pasteurized and homogenized? In raw milk, the minerals sit in immunoglobulins or globulins that ferry the minerals across your intestinal walls, and the body knows how to deal with these. These are the minerals that land in your bones. Whereas pasteurized dairy, the calcium lands in your soft tissue. And what are your arteries? They're soft tissue. So you find that people who drink raw milk, literally their arteries get cleaned out. If you're on pasteurized milk, you will get arteriosclerosis. This calcification is one of the big causes of arterial hardening.
Is there anyone that shouldn't drink raw milk? They say like babies and people that are elderly, but I would think more not about your age, but more maybe about your immune system. Is there any issues about
If you are on immunosuppressive drugs, the only people I can think of who might need to be careful with this is people on immunosuppressive drugs. For babies, it is the elixir of life. Remember, mother's milk, breast milk is raw milk.
Yeah.
Raw milk
Makes sense.
with tumor necrotic factor, with immunoglobulins, with minerals, with fats. It's a beautiful immune system that the cow and the mom are giving to the child. So especially during pregnancy, I would recommend women drink a quart or 2 of raw milk daily to get their calcium, their minerals in a way that'll be very positive for them and the child.
So is chemo immunosuppressive?
Chemo is very immunosuppressive. Radiation is very suppressive of every living tissue, pretty much. So
Suppressive destroys.
and destructive, and extraordinarily destructive.
So what is that disease that somebody who's in the medical profession will say, raw milk?
So,
What is that?
so raw milk has not killed anyone in the last 30 years. Pasteurized milk has killed people. If you put a jar of raw milk and pasteurized milk side by side on the counter and go away for 2 weeks, you will come back and notice that the raw milk turned into clabbered milk, which is a delicious fermented brew, whereas the pasteurized milk became putrid. So raw milk has inherent protective factors that cause the lactobacilli. Lactose is a sugar that is not meant for a baby or you, it's meant for bacteria. So the raw milk is trying to encourage lactobacillus to grow in the baby's gut. So when mother feeds a baby raw milk, her own breast milk, it causes lactobacillus to grow in the child's gut. So she's educating the immune system and the gut microbiota of the child.
So the disease is closed-mindedness.
Well, I have a friend who's really neat, and she's a diabetic pregnancy nurse, and she just gasps when I mention raw milk. But because of because she's not young, she's been through a lot of nursing and medical, and there's something that people would get when they drank raw milk back when.
Yes. And so to really understand it, you have to go to the CDC website and Google raw milk deaths and pasteurized milk deaths. Pasteurized milk has caused more death and disease in the country than raw milk ever has. And raw milk is grown under very specific circumstances. It cannot be impure because it's milk taken straight from the cows. It's not commingled with other cows' milk, and it's not processed. So it's just bottled.
I agree. I just am wondering what that is that she's talking about. I'll find out.
And those sort of false ideas, myths, and statistics are used by the big dairy industry to shut down a lot of raw farmers who are supplying our autistic children with raw milk with which they're having excellent
I'm
results.
not sure years ago they said that the raw milk was creating problems. And I'm not sure it was the raw milk or the way it was once it came from the cows.
Exactly.
Yeah.
What about the
Temperature.
facilities that they put it
Exactly.
Well, that might be part of it. That might be it.
I
but
think there's a lot
this
to do.
is still tricky.
All I can tell you
that's what
that
it is.
in medical dental schools, they get that much nutrition
That information.
Yeah.
information. They get almost none.
Yes. Yeah. But she's
So
in.
your
She
doctors, you go to
understands
the day.
nutrition, but
Know nothing
they'll
about
not.
nutrition.
I bet it's the storage and that from
That's
way
what
back.
I would bet.
Yeah.
That
That's
They
true.
didn't have ways to chill it or do
Yeah.
other things.
But one thing that
Shouldn't
will
have to
allay
go for-
all your fears is raw milk is inherently, it has inherent
right.
systems that make it safer because it clabbers. It doesn't putrefy.
Yeah.
So if raw milk is sitting on your counter for 20 days, it's actually amazingly delicious. Whereas pasteurized milk will kill you if it's on your counter for 20 days.
Raw milk is part of nature.
Yeah. I agree. I just was wondering what that. I'll have to find out from her what that.
So on one of the talks, the videos that I was watching, they mentioned something that I hadn't realized, that during World War II, when with the war in the like Philippines and in that area, that when soldiers were seriously injured, they would take coconut water
Yes.
and use it as transfusions instead of the blood, because they didn't have the blood to use. That coconut water is so close to the composition of our blood.
It's like a saline solution.
And so if you're, drinking coconut water, now here's the thing that I hadn't realized. They talked about if you're buying coconuts, buy the coconut with the brown hairy stuff on it, not the young coconuts, because it takes something like 8 or 9 months for the coconut water to filter through the meat of the coconut and become really pure. And so that's what they would use for the transfusions.
Interesting. And tender coconut eaters, avoid eating tender coconuts. They are preserved in formaldehyde type solutions as they come from Thailand. So if you want to eat a coconut, eat that big old thing that you rip the top off of.
Yeah.
You're not eating a health food. But coconut water is amazing if you can get it fresh. So alcohol speeds up the excretion of magnesium. Diuretics, so if you drink coffee, a lot of coffee, it speeds up mineral excretion levels. And try and eat organic foods to get more magnesium in. Sources are nuts, legumes, green leafy vegetables, some grains, oysters, etc. Some meats. But so, if you suspect heart issues, the first thing you want to up is magnesium. Atorvastatin. My friend also got a prescription of atorvastatin, and that's to reduce cholesterol. But she didn't have high cholesterol, but they do it anyway. And so The cholesterol did not cause her heart attack. Actually, cholesterol does not cause heart disease. As a matter of fact, cholesterol levels are normal in 75% of the people who have heart attacks. And so it's a red herring in the heart attack industry, but atorvastatin has severe side effects. What it does is it interferes in the CoQ10 metabolism of a chain of enzymes in your liver, and you need CoQ10 for muscle functioning. And statins actually have caused a doubling of heart failure. What is your heart?
Muscle.
It's a muscle. You take statins, you have muscle failure. They have sort of terrified her into thinking that if she doesn't take the atorvastatin, she'll get another heart attack. Nothing could be further from the truth. Cholesterol is very valuable. It's the underpinning of every one of your hormones. Testosterone is made from cholesterol. Estrogen is made from cholesterol. Aldosterone is made from cholesterol. Cortisol, all your hormones, DHEA is made from cholesterol. If you don't have ample cholesterol in your body, your kidneys cannot make the hormones they need to clear fluids, to regulate your blood pressure, your glucose, your hormone levels, your reproductive hormone levels, and you're in grave danger. So please eat cholesterol-rich foods like egg yolks. So even if you don't like eggs or egg whites, I would say eat a couple of egg yolks a day, and that will keep you from getting heart disease.
If you look at the drug industry, one of the highest profits they make is from cholesterol medication.
Yes.
They make billions every year.
Billions. Yes.
So naturally, they're going to push you and say, bad cholesterol will
Yes.
do this and this and this.
Yes. It is the most prescribed drug for men and women over 40. I think 1 in 4 men eat Lipitor. And you see that statins shuffle. People walk like that, their muscles are not working, their brain's got a fog in it. Cholesterol is needed for brain functioning. 40% of the cholesterol in your body resides in your brain. You have a butter stick's worth of cholesterol in your body, and if it goes away, terrible, terrible things happen. Cholesterol is antimicrobial, antiviral, anti-cancer. So if you have high cholesterol, it's not that cholesterol is bad, it's that you have other issues that your body needs cholesterol for. It's like the firefighter that is blamed for the source of the fire when they've come to save the inflammation or cool off the inflammation. So any heart issues, you want to avoid atorvastatin, Lipitor, they're called by 100 different names. And it is a very, very serious problem for your heart muscle. It'll cause your heart muscle to be malnourished. So when I meet a person who is over 60 or 70 and they get this thing in their heart or they have loss of breathing, I have this sort of urge to accompany them to the doctors to make sure they're not talked into stents and statins and aspirins and yada yada yada, because it'll just destroy that person. It'll just destroy that person. But that's not to say you shouldn't go to doctors. You should go to doctors. You should get yourself measured. But when it comes to a decision, I would recommend you go back home, think it through, Google it, talk to friends, talk to professors who study fats and lipids and cholesterol, and then make a judgment. Frequently, you don't have the time to do that because you're like, the doctor says, oh my God, you've got 3% room in your coronary arteries and you're a walking corpse if you don't get these stents. Nothing could be further from the truth, because you would not be standing up if you did not have good blood circulation to your heart. What does Plavix, etc.? The anti-clotting drugs have serious side effects. So you get nosebleeds, and my friend got a lot of nosebleeds. Petechiae. Petechiae are like little bleeding things where your capillaries start to bleed, and so your tissues are not being nourished anymore. You feel chest pain, heavy feeling. So it actually is the cause of downstream heart disease. You feel numbness. You can get permanent neurological impairment, sudden headaches, confusion, problems with vision, speech, and balance. And so I felt as though I took a friend to hospital and came back with a walking dead person for several months afterwards. It can cause hepatic failure. It can cause liver failure. You have pale skin, weakness, yellowing of the eyes, jaundice, etc. And that's just the first set of drugs. In addition, she got levothyroxine to jack up her thyroid. She got lisinopril, which is a diuretic to help reduce your swelling. So what that's doing is messing with your kidney function. She got nitroglycerin, which was the one thing I would say that was good because it caused her capillaries to expand. But guess what other food causes your capillaries to expand in the event of a heart attack? Anyone know of the food that can prevent heart attacks? Cayenne. Little cayenne under your tongue. Keep some cayenne in your purse. If you're a family that's got a history of heart disease, you feel something come in, it'll make your eyes water, but you'll wake right up. And so nitroglycerin is for small heart attack, angina pains, in persons that are prone to these. She got Prilosec-like drug at 4 times the prescription she had before. And I gave the doctor John Cook's research on proton pump inhibitors, and yet he ignored that and gave her 4 times the strength of her previous Prilosec, which is almost guaranteed to give her heart attacks down the road.
Cayenne. Anyone wants to try some?
So try holding some cayenne under your tongue. What does Prilosec do? What do antacids, these proton pump inhibitors, do? They actually cause heart attacks, and the cure for that is to eat a high-fat, high-protein diet with a low-carbohydrate diet, and that'll take away your stomach acid reflux. For people, especially on vegan vegetarian diets, this is very critical because they have a lot of acid reflux. What the PPIs do is, or the Prilosec does, it reduces your body's ability to make a substance called nitric oxide. And nitric oxide expands your capillaries. And when you eat it for 20 years in a row, your capillaries narrow. And at the end of the capillaries, where they transfer oxygen into your tissues and food into your tissues, your tissue gets malnourished. Your heart tissue gets malnourished. So heart attacks are really a sign of and especially in women, are on antacids and certain drugs, capillary small vessel disease. Smokers have less nitric oxide. People with diabetes or insulin resistance, their capillaries are not able to expand, and so many people think of heart attacks as diabetes of the heart. If you go on a high-fat, low-carbohydrate diet, heart disease resolves itself, like in Lori's case. And so you want to have a diet that reduces insulin, the effects of insulin in your diet if you have heart disease and if you are insulin resistant. Smoking will cause small capillary disease. Drugs will cause small capillary disease. And so people with insulin resistance, people who are on acid blockers, I would really recommend a ketogenic diet. And second heart attacks are very, very common with proton pump inhibitors. And it's very likely that she will have a second heart attack, and that'll be fatal because the first attack just felled her. What is the cure for congestive heart failure? Really, it's a lifestyle cure. Medications will not cure, put into remission heart disease. None of these medications improve your survival rate. They will keep you alive for the short term and then, greatly reduce the quality of your life. Food is very nourishing. Food such as magnesium even, or supplements, don't have side effects. You want to eat nourishing fluids like yogurt, kraut, soft meats,
What are
organic
soft
vegetables.
meats?
In stews, meats and stews, cooked in butter. You want to rest and reduce your stress. You want to take naps. If you feel like a nap, take a nap. Have your friends visit you. Don't get out of bed for everybody if you don't feel like it. Turn off tube lights.
Question. In there we say vegetables cooked in butter.
Mm-hmm.
What about vegetables cooked, use olive oil?
Absolutely. Olive oil is awesome. Yeah.
So there's no big difference.
There is a difference.
What is it?
The difference is butter contains a different set of fatty acids than olive oil does. Butter contains about 50 to 60% saturated fats, 30-35% monounsaturated, and 2 to 3% polyunsaturated fats. Olive oil contains largely monounsaturated fats, so it's not. It has about 60-65 monounsaturated fats, about 20-25 saturated fats, and a few polyunsaturated. So the composition of the fatty acids is very, very different. And what you want is a variety of fatty acids, and you want it to be like the fat composition of your body. So if you looked at your body, it's got about 60-65 saturated fats. Your cell walls are largely made of saturated fats, some mono, and very, very few polyunsaturated fats. So butter, lard, coconut oil are the more saturated oils, not fully saturated. Olive oil is pretty saturated, but is largely monounsaturated.
I have a question similar to this. You read that I don't know how many people fry anything, but it's supposedly if you use olive oil and you're frying, you're
destroying it less. Yes.
But what about butter?
Butter, when rendered, so butter I would not recommend as a cooking fat, except to very lightly saute.
For example, I eat eggs very seldom, but when I do, I'll fry an egg in butter.
You could if it's low temperature, but I would recommend ghee, which is rendered butter, because butter contains proteins, and the proteins will burn at high heats. So the rendered fat has very high smoke points, like 400 to 450 degrees Fahrenheit. Cold pressed fats like olive oil, coconut oil have lower smoke points, like 250 to 300 degrees. But ghee, butter, ghee, lard, tallow have very high smoke points. So cooking, I would recommend saturated fats. And the saturated fats are less saturated, so they get less destroyed. So if you want to cook, I would recommend saturated fats. If you want to eat them raw, you can eat butter, olive oil, sesame oil, peanut oil, all the monos. Huh?
Red palm oil.
Red palm oil,
Red
yeah.
palm oil tastes like butter too.
Yeah,
It has
yeah,
E and A, a lot of vitamins E and A.
Those are beautiful fats. Eat sea salts. Any diet that restricts salt is restricting minerals, is restricting potassium, sodium, magnesium, and will cause more heart disease, not less heart disease. The American Heart Association recommends 1.5 grams of salt, which is a killer dose. You need 4 to 5 grams, which is, 3 to 4 teaspoons of salt in your diet. People who eat more salt live longer.
Good salt.
Good salt. I should preface that, yes. Not refined salt. People who eat sea salt live longer. And eat it to your satisfaction. You're not a saltaholic if you want to salt things well. Eat good fats. Doctors, you're right, get almost no training in nutrition. They have like a couple of hours. And so I talked to the doctor and I said, what should she eat? And my friend was asking the doctor, should I not be eating saturated fat? Should I not be eating salt? And he didn't really have much to say. And he said, yeah, well, sure. You can eat pretty much anything. But the truth is, food is what matters the most in any kind of heart disease.
What do you mean is soft meat?
Soft meat means meats and broths and stews and, like easy to chew and eat. They'll digest better. The heart preferentially metabolizes saturated fats. So coconut oil, ghee, lard, and tallow are fats of the heart. If I were to open your heart today, you would see a big layer of solid fat around the heart. And the reason for that is saturated fat is very compact. The body has like 400 to 500 grams of carbohydrates in it at any given point between the glycogen and the teaspoon of sugar. But the body has 80,000 to 150,000 calories worth of fat in it. You've got fat here, you've got fat around your organs, and in an emergency, the heart works better with fat. So the heart loves ketones, which is the smaller, the 2-carbon, the fatty acid metabolites. So always, 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 if you have a heart problem, try and eat a load of saturated fats. A low-fat diet will cause heart disease. Try not to, in fact, you should avoid refined oils. That is one of the key things you want to avoid. Unrefined salts contain 60 to 80 minerals that you want. So if there's one health investment you want to make, you want to buy good sea salt. It's $3 to $6 a pound. Buy a variety of salts, buy a variety of fats, and eat them all.
Under natural care,
Mm-hmm.
I was going to say one thing, because when we thought maybe it's a heart, whatever I'm dealing with, that the heart meridian, I guess, goes to the middle finger. And so I was always taught, because my daughter, instead of sucking her thumb, sucked her middle finger. And I thought, oh, that's the heart meridian. So, you know, each finger is something. So if I felt some of that pressure or the nausea, I would just massage all my fingers, but I especially paid attention to my middle finger. And then I started carrying these little, they're these wonderful crystals that just fit your thumb so nicely, and you can relax just by holding them. So I'm trying to use all sorts of things to do it as natural care.
Are you suggesting this care after a heart attack, after the hospital, or in place of the hospital? What are you?
I'm suggesting this as a preventive. And after you come out of the hospital, I'm suggesting this kind of a diet, not a low salt, low fat, skim milk diet.
It's restorative.
It's a restorative diet. And that kind of brings us up to what causes heart attacks. What causes heart attacks? And one of the things is cayenne, and the other natural sort of substance that's administered is something called strophanthus, which is a metabolite of the digoxin, the digitalis family, that's administered with great success. That Cowan, my doctor, has administered with great success to all his heart disease patients. And that brings us to the sort of the non-plaque myogenic theory of heart disease.
What is strophanthus?
Strophanthus is a vine. It's an African vine that they extract a substance, a digitalis-like substance from it, and it's a cardiac glycoside. And it has almost the same structure as the hormones made by your kidneys to prevent heart disease. And so your kidneys are critical factors in preventing heart disease, because they make the cardiac glycosides, which by the way are made from cholesterol, so eat lots of cholesterol. So your kidneys make the cardiac glycosides whose analogs in nature are foxglove, digitalis, digoxin, strophanthus. And what these things do is, when your heart muscle is stressed, when you have capillary disease, you might have diabetes, you might be a smoker, you might have huge amounts of stress, and that will cause small vessel disease. And what that does is, these small vessels are also feeding your heart. And when the heart is not nourished, the tissue necroses. So flip the plaque theory on its head and think about it this way. You are stressed, you have diabetes, you are sleep deprived, near and dear one died suddenly, and you are heartbroken. All of a sudden, your capillaries contract. Your capillaries contract, your heart muscle cannot be nourished, and therefore there is necrosis in your heart muscle. The cells die. The cells, where do dead cells go? How are they metabolized? Through your blood vessels. The cells enter your blood vessels, create a blockage. So the blockage does not cause the heart disease, heart attack. The heart attack is caused by the tissue necrosis, and the blockage is incidental or happens after the fact. And there's a lot, and this is difficult to get your head around. There's a lot of research that shows that after a heart attack, the longer a person survived, the greater the degree of blockage, which means as you're having that heart attack and there was tissue necrosis, it was blocking. It was like an accident on the highway, and it was not the blockage that caused the heart disease. It was the accident that happened before in your tissue that caused the heart disease. So taking measures like reducing plaque is not going to prevent heart disease at all. What is going to prevent heart disease is preventing small vessel disease. One of the primary culprits for that is diabetes or insulin resistance. As you age, as you grow to be older than 50 years, you want to have a diet that reduces the role of insulin in your body. Your capillaries need to get healthy, and once your capillaries are able to deliver nourishment to the heart, that's going to reverse heart disease. So when you block, when a big major coronary artery is blocked, it doesn't prevent future heart attacks. All it is doing is clearing that particular artery, but you wouldn't have died of that anyway because you had collateral arteries that sprang up to make up for the blockage in that artery. And what's gonna take back or revert heart disease is diet. Taking sugar out of your life, taking stress out of your life, taking smoking out of your life, taking proton pump inhibitors and certain drugs out of your life. And so when you go to a doctor with a blocked artery, it is a red herring to unblock that artery. You're actually messing up the collateral vessels that were set up by your very smart body to deal with that particular blockage, which probably was caused due to a heart attack, so to speak, in your capillaries. So think of a heart attack as a capillary attack, really. And the more you can do to cleanse your capillaries, the less debris will flow into your bigger vessels, and you will reduce your chances of heart disease.
Yeah, if I remember correctly, I was at one of Dr. Cowan's lectures, and he was saying that they discovered during autopsies that's when the accumulation started to happen. It wasn't that it caused the heart attack. They could see that it was accumulating after
The heart.
So when they're doing an autopsy and say, oh, there's this accumulation, they're assuming that that's what
The blockage caused the heart.
Yeah, but it's actually happening. The blockage is happening after.
But there's a $1 trillion industry that's built on cholesterol, on plaque, on bypasses, stents, surgery, blood thinners, etc. And think about that as the big red herring that has nothing to do with actual heart disease. So, what is the role of strophanthus? When your capillaries are not able to breathe, when your capillaries are not able to work properly, the cells in your capillaries, what's happening is your cells go to fermentation. They go to anaerobic energy metabolism to make energy. And what's happening when you go anaerobic is lactic acid. You have experienced leg cramps, right? And what is that? That's lactic acid in your leg muscles. Literally, the same thing happens.
Really?
Yes.
I get it in one leg, but I do it when I'm stretching out in bed.
Yes.
I don't get it any other time.
But at
except
that time.
then.
Yeah.
So I don't know if that's a lack of.
So muscles, when you have cramps, typically, there could be minerals as well. So it could be a mineral deficiency and so on. But typically, when you're running and you're exercising a lot and you get a cramp, you got lactic acid.
I jog every day. I don't get it.
You jog,
I do get it.
Okay. That's a different,
Early in the morning, at night, if I'm stretching out a certain way.
You get it.
So when you're stretching, you're not bouncing or anything.
I don't know, I'm doing something in bed
Because-
the way I'm being.
Yeah.
Because when you stretch and you're doing, a lot of people think to stretch you've got to bounce, but then that's stimulating the muscle to shorten rather than to stay lengthened. So
That's why
never
the flick-
bounce.
But that's why the flick actually goes one step past the bounce.
Yeah, never bounce when you're stretching. Because
I would increase fats, fat-soluble vitamins in my diet. I would try cod liver oil, try, ghee, cook in ghee. You might want to consider cooking in ghee. Cooking in ghee, clarified butter. But when your cells start fermenting, meaning when your cells start to exude lactic acid, that's when in a leg, your leg shuts down. When you have lactic acid in your leg, but you've got two legs and you can stop, but your heart cannot stop. And so when your heart has lactic acid in it, your heart muscle gets destroyed, and that is a heart attack in that part of the heart that did not get the nutrition, the oxygen that it needed to get. And so strophanthus is a drug, it's a glycoside, it's a cardiac glycoside like digoxin that mops up that lactic acid and converts it to pyruvate, which is a heart healthy chemical. And so it's literally going in, taking the lactic acid, replacing it with pyruvate, and you don't have the heart attack. Angina pains, they did studies in Germany where 140 patients administered strophanthus, angina patients. Everyone know what angina is? It's pain in the heart, and small pain is angina, larger pain could lead to heart attack. So it's basically your heart muscle not being nourished. And when they are given strophanthus or a digitalis-like compound, their angina disappeared in 90+% of the cases. Cayenne has a similar effect. But it's important to think about heart disease as a disease of the small vessels, and especially for women. What happens with women is it frequently appears as digestive difficulty. So you get exactly what you got, which is you feel nausea, you feel intestinal pain, you feel its acidity, you're getting diarrhea or stomach cramps. So women should not neglect those signs and symptoms. They should consider, going to a doctor, getting stress tests, and so on. Sunshine did something very different and very incredible, which is she said, I don't want to go to a doctor just yet. Tell me what'll make it go away, and then I'll consider going to a doctor. And she's smart, she's very intelligent, because part of the story is that the second you go to a hospital and doctor, you get into this red herring path where
Conveyor belt.
the conveyor belt where they scare the living daylights out of you. Oh God, you got a blockage. Oh God, we got to put stents in. Oh, that's surgery. Oh, and you got to be on these 10 pills. And you have a hard time telling your doctors, gee, I don't want to, because it's your health and your life. And my friend was terrified into taking a lot of these things.
And you go to them because they're educated.
Exactly. And you trust their opinion. You trust their opinion.
I've had patients who I've taken history
Mm-hmm.
when I was practicing
Mm-hmm.
that were on 19 different medications a
Oh,
day.
Oh.
You can't, it's just unbelievable.
yeah. It's like a potluck. It's like you don't know what's causing what. Yes.
But part of that is like I was helping a woman who was diabetic too, and she was on the diabetes, whatever I can't remember which medicine she was on, but her pantry was filled with candies and and her freezer was filled with danishes and cakes and stuff, and she said, but I can eat them because I have the medication. So that's why some people take
That's
some
the
of the
logic.
medications.
Yeah, there
they
you go.
think it gets them around
To
the
eating what
issue.
they want. Yes.
And when I told her, I could get her diet changed, she fired me.
Yes. There's very few people like you in this world. You're a minority.
So, if Sunshine had gone to a regular doctor, they would have said, oh my gosh, we're gonna, who knows, do these tests, put in a stent, put you on a statin.
You probably would have told her she's pregnant.
And you're not gonna do that. I'll just say you're not.
Yeah.
So, then is it just finding the holistic doctor is that the key? Because a quote normal doctor is gonna put you in that other path.
In that pipeline, yes.
And that's a path you don't wanna go down, so is that where the difference is getting
That's
the
the
right
difference,
doctor?
Yeah. So the whole reason for this talk is you go to a doctor, you get the stress test, you go get the troponin test to see if you had a heart attack, you get all your blood examined, you get all your tests done, and then you say, okay, I got it, and the doctor's gonna tell you your arteries are blocked and you need this and that. You take time out. You say, okay, I'm not dying of a heart attack tomorrow, let me go back. The problem is that when this occurs, very few people are able to resist the scare. It's like when you get cancer, the doctors, you gotta have chemo and you gotta have radiation tomorrow. And what Sunshine did, in a sense, was what you did was extraordinary, which is she said, I don't want to go there because I don't want to be having more stress that I'm not obeying the doctor's orders. Now the doctor is telling me one thing, I feel something different, and I have to then go find a holistic doctor, and it's going to take time, and who knows, I might die in the meantime because they scared the living daylights out of me. And it sort of takes that whole thing away if you have a good understanding of what your heart is, what could lead to a heart attack, and do certain things to ameliorate it.
And I had this little device, and I would check it from time to time and said what my heartbeat was, and it was between 54 and at a high of 72.
That's low.
That's really low.
And you could say she was taking a winged
I was taking while I was resting.
Oh.
So I mean, I was lying down, and I said, "Oh, I'll check that." I know I wasn't taking it while I was doing other stuff.
After a run, right?
No.
But it's very difficult to do what she did. And she had cayenne, so I said, if you get a heart attack, just chug, take a teaspoon of cayenne, and it'll prevent a heart attack.
So instead of like people say take an aspirin,
Or nitroglycerine.
you're saying
put
take cayenne.
Cayenne
Yeah.
under the tongue will have a very similar effect. It will expand your capillaries. A cayenne expands your capillary. But you've got to have enough confidence to know this is small vessel disease. This is not heart disease as defined. Because heart disease as defined is caused by plaque, cured by cholesterol, cured by stents, surgery, and a whole bunch of drugs. It's not. It's not. It's a diet. It's a matter of diet.
And I put cayenne into some of my drinks and other things so that I wasn't waiting for some, it's kind of as a preventative. And I carried with me my rescue remedy,
Which is
Bach flower essence.
What
You
is
know, it's a Bach flower essence. It's called rescue remedy. So like if you're ever in a situation where there's an incredible amount of stress, you put a few drops under your tongue and it just, helps with the rescue remedy, Bach flower essence.
But,
Bach.
B-A-C-H.
B-A-C-H. It's homeopathic.
I can't take it because it has some sunflower derivative.
And one of the first rules in something as precious and caring for something as precious as your heart is do no harm. The first rule is do no harm. There's a lot of very good foods you can eat to make your heart feel better. Mineral-rich foods, fats to dissolve to assimilate the minerals better, the right supplements, the right cayenne, the right enzymes that give your heart a kick in the event of a problem. And then the question that you'd ask is, so why did I get a heart attack, or why is my heart suffering? And the answer to that is small vessel disease, but it is all guided by your autonomic nervous system. So everyone know about the two nervous systems? You have the central nervous system and the autonomic nervous system. Your autonomic nervous system has two branches. One is responsible for the stress response, which is the fight or flight response. So if you're being chased by a tiger, your sympathetic nervous system gets into gear and says, body, forget about the liver and the spleen. You want to put blood into the heart. The kidneys secreting hormones that cause adrenaline to rush through your body, and you run for it. That's the stress response of the autonomic nervous system. And then the other response that the autonomic nervous system is responsible for is, anyone know the other response? The what?
Parasympathetic.
Parasympathetic, that's right, the parasympathetic nervous system. And that's responsible for the workings of all your organs, your abdominal organs, the rest and relax system. And what happens is, when you jack up your stress response, your parasympathetic, which is the other, it's like two arms of the same system. Once you raise your stress levels and the stress responses, your parasympathetic nervous system declines. And if you decrease your stress response, your parasympathetic nervous system gets enhanced. So stress is a very important predictor of heart disease. If bad things happen, make sure you know how to meditate. Carry rescue remedy. Carry stones that make you feel calm. Learn to meditate so that you don't constantly feel, stop drinking caffeine, because that will jack up your adrenaline. so that you don't constantly have a stress response, because the stress response will subdue your parasympathetic nervous system. And your parasympathetic nervous system is responsible for the beating of your heart, your digestion, your gallbladder, your liver, and so on and so forth. So you feel yourself stressing out, if you feel yourself to be around toxic people, learn to walk away. Have a good friend that tells you when to leave.
Yes.
You know, may I add something to
Sure.
that? The stress probably creates most of all our problems. But I think in terms of if you're eating a meal and you're stressed out, that meal's not gonna get digested properly
Exactly.
and
So
and
true.
assimilated properly.
Not watching the news when I,
Yeah.
yeah.
You know, this is where some cultures will sit and take 2-3 hours to sit and have a meal.
Yes.
They're doing it in a relaxed way, which is very beneficial. I'm sorry. I
Yeah,
didn't
no, that's
And-
absolutely critical.
And
the
in
most
that same
wonderful
vein,
thing.
not stressing, oh, I'm having a piece of this thing and I should, no.
Yeah.
You know, be nice to yourself, you know, I mean, there's room, you don't have to be
Yeah,
perfect.
enjoy it.
Yes. The
Yeah.
stress will kill you before the processed food does. Yes.
There's a parasympathetic nervous system, and what's the opposite one called?
The sympathetic.
Sympathetic,
yeah.
thank you.
Think of the sympathetic nervous system as the simpatico nervous system that comes to your rescue when someone is torturing you or when you're followed by wild dogs. And the parasympathetic nervous system. And so in women, frequently, you have digestive problems, you have acidity, as in the case of my friend, and heart disease. You have gallbladder disease and heart disease. You have liver because it is all guided by the same nerve. And so you want to get massages, you want to calm down, you want to do things that take away the stress in your life as much as possible. And that's very hard to do. And so we should probably do pranayama every time we're here. And
We should be doing it while we're
while
here.
we're here. And is anyone open to doing an Om and maybe a Brahmari?
May I say something first
Yeah.
though? Because I didn't mention it when before. When in the morning I'm not eating anything, Sushma said, well, just take a drink of water. You know, my salt water or whatever it is with the kvass, the sauerkraut juice. So it's true. I would get hungry and I would just take a drink of water and I'd be satisfied. It's really strange.
It's very
But it works.
strange.
But it works. The other thing I want to mention is I was at Sprouts the other day, and they had a woman there who had a display of bone broth.
Mhm.
And I took it to my famous tester to taste it and try it out. Sushma tried it out. I tried it out.
Loved it.
It was delicious. It was they have chicken bone broth, 2 types of chicken bone broth, and they have 1 type of beef bone broth. And the name of the company is BRU.
Brew.
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 Oh, I think
And they're
that's
local.
awesome.
There's some local moms who have
Oh,
created this, and
It's the cold
The
broth.
cold broth.
Yeah, I just read an article about them.
and you can heat it and drink it, but we drank it,
It was pretty
just as it
delicious.
was. It wasn't cold anymore, but it was cool. And like the beef one had cayenne in it and had, was it ginger?
Ginger, cayenne, garlic.
It was
spices.
very,
What was the
very
packaging?
nice.
From Sprouts. What was the packaging?
A plastic
Wow.
bottle. Unfortunately, and I said, well, I don't like plastic bottles. They said, we have to do that because if you put in a glass bottle, you have to pasteurize it or something.
Yeah.
But in this plastic bottle, they cold press somehow, and they don't heat it to the
Right.
pasteurization point.
So Sprouts is carrying this?
Yeah,
Well,
Where at, what,
it's in a
Pardon me?
refrigerated
Cold
section.
section, the
It's
cooler
in a
section.
refrigerated section.
So I have a friend in San Francisco who is actually working on starting in communities, and she has a tiny house, and she's been making bone broth. I've been bringing it to my mom,
Wow.
and she what she did. She bought a cow up in. She shared a cow with someone up north where she got certain parts of it, and so she's actually was thinking of doing subscriptions, and she does it in glass because we also hate plastic. So I don't know. Should I write you an email?
Absolutely. I'll
Because
send it
I
out to
can't
everybody.
I
understand,
think-
glass is better than plastic. If
I know,
plastic,
that's what
the
I said to
chemicals
her.
can
Yes,
leach
yes.
out.
But
Well, but you know-
it's cold, it's not heat, the stuff that's put in there is not hot.
But also when
So
you're
it won't
making it in
leach
mass,
as-
it's really hard to do it in glass. I mean, it's a manual procedure, so that's probably why they're doing it in plastic.
Well, and they're doing it because it's not something you're gonna keep for long, you know, and you're not gonna reuse the bottle or anything like that. And unfortunately, it is in plastic, but it's delicious.
It's a delicious product.
And the chicken one has turmeric and, I can't remember all the things, but really good stuff in it. And
Smell it, taste it
pastured-
clean, taste it very
Pastured beef for making the broth.
Yeah.
Organic
obviously
pastured
the-
beef.
The chickens and the beef are good, obviously.
Yes.
Yeah,
they are.
my friend even makes one for people who are vegetarians. She's not a vegetarian, obviously. She's more like with the fats and everything. But and the veggie one has like mushrooms and all, she mostly mushrooms.
Mince.
There's so many good things. But she does, I think, chicken. She does a lamb one even, veggie.
Yeah.
Chicken veggie, maybe a
I love
turkey. I don't know because I've been gone for a while. So she just came by my house yesterday
And
with
delivered.
a house rewarming package since I was gone when I came back. But I got a turkey one and a chicken one, and I cannot wait. Should have brought it this morning, but I was overslept. So yeah, bone broth is exceptional, and I think it helped you a lot when you were getting healing.
Yes.
Oh, yes, especially fractures and bones.
Yeah.
Um,
So sorry I interrupted.
Oh, no,
It
food,
was a
food
good
is always
thing,
welcome,
but
yes.
I should have thought of that before.
But there's certain general principles that you wanna pay attention to, and that's the 7 toxicities. Heavy metals. There's a lot of heavy metals in people's bodies, our children's bodies, and the environment. Everything from supplements are contaminated with massive amounts of aluminum, so try not to eat too many supplements. Vaccines contain a lot of heavy metals, light metals, aluminum and mercury, and those are very, very heart toxic. Persistent organic pollutants and chemicals, these are your herbicides and pesticides, certain types of drugs, EMF. Do not hold cell phones near your head, turn off Wi-Fi at night. These are sort of standard procedures, standard protocols, and good for your heart health. Emotional and psychological, minimize the stress in your life. And food. By food I mean genetically modified food, bad foods. Avoid all those foods. And it's important to get something spiritual in your life to keep your parasympathetic nervous system nourished. Very, very important, because it governs how your stomach works, how your heart works, how your liver works, and all your different organs.
Hennessy.
So we have people that have joined and are watching on here. One with Sue Rope,
Sue Rope, I
not
think, yes.
Hennessy, yeah.
Hello, Sue Rope Hennessy.
And then there's Mike, is it Eckenbach or something like that? Anyway,
Lockenbach.
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 So they're on board.
Okay, all right. And I wanted to leave you with one final thought, and that is kidneys. Kidneys are the mother of all organs, and heart function is regulated in large part by your kidneys. Your kidneys have a walnut-shaped organ on top, a little glob on top called your adrenals, and your adrenal glands produce all sorts of hormones, including the heart hormones, so the cardiac glycosides, that are very, very critical to good heart health. So you want to keep your kidneys toxin-free. You want to eat a lot of cholesterol, which is egg yolks, salmon roe, oysters, to nourish your adrenals. Give yourself massages in the back. Your kidneys are the back of your spine. Do yogasanas that stimulate your kidneys, because the kidneys contain they have a cortex. The adrenals contain 2 areas. One is the central part called the medulla, and one is the outside part, which is the cortex. And the cortex makes all your aldosterone, your cortisol, so it manages your glucose metabolism, your blood pressure, your adrenal androgens, which is your male sex hormones, which are critical for functioning, DHEA, and the medulla makes your adrenaline, which is the epinephrine and the norepinephrine. So your fight and flight responses are ruled or governed by your adrenals, and your parasympathetic responses are also governed by these tiny glands. And these are the glands that make the cardiac glycosides, which are critical to preventing heart disease and small vessel disease. So the Chinese, when the Chinese say the kidneys are the seat of the heart or seat of, the body's intelligence, they're very right. You pass 180 liters of fluids through these kidneys every single day. And the main function of the kidneys is to reabsorb most of that back, and you pee out a couple of liters, 1.5 liters, a couple of liters. But they are responsible for making sure the right amount of very directed amounts of magnesium, potassium, chloride, sodium, etc. are maintained in your body. And that kidney function is critical for the heart, and kidney function is very impaired by which disease? Anyone guess?
Cirrhosis?
Cirrhosis as well, but diabetes. Diabetes will destroy your kidneys. And what do we have in the United States today? We have an epidemic of diabetes or insulin resistance. You take sugar out of the equation, you take insulin out of the equation, your kidneys function better, you secrete cardiac glycosides out of your adrenals, and your heart health improves. So an anti-diabetic diet is a pro-heart health diet. And I think we're out of time. Thank you. Do we want to? I will